concerned about the health insurance fund because we've actually taken suggesting that it might be getting short of money because only in the last couple of years we've taken something like £26 million out of it to prop up the health and social services budget. So that's a bit scary. It's now been suggested there might be a deficit on the health insurance fund. Prescriptions, very, very simple, isn't it? That they are free. I suspect they'll continue to be free for a long time, provided there is the proper discipline by the doctor prescribing and the pharmacist dispensing. I don't see that as a problem. And I've got to say that up to recent times, the way our primary healthcare system has worked very well, because when you compare it with the United Kingdom, at least even though you're paying, you can normally get an appointment quite soon with your doctor. In the UK, you can't. Sometimes you can't make an appointment, you've got to queue there for days, and to try and get one to come out to you in the United Kingdom, in some areas, almost impossible. Here at least you can do it even though you've got to pay. Now the problem is now the cost of it is escalated beyond many people's means, and when they do need a doctor, that they will hesitate to do it. Some practices have now recognised the problems and are offering lower charges or either no charges for young people, but of course that doesn't help people of your age and my age. And when you start to analyse the situation, really we've got it the wrong way round. The hospital is free. Accident and emergency is free. But primary health care, and primary health care means you go there first, you pay. And yet what we want to do is to free up the hospital, free up A&E, and get people going to their doctors at primary health care. So really, I think we've got it now, and it's worthwhile up to now, but now I think we need to think out of the box. And perhaps it should be the other way around. And we should be having primary health care free, or at a much lower cost than we're experiencing now. Because I don't like things that are free, because I think they're totally free, people don't value them. But as a very low cost primary health care, and perhaps an increased cost, an insurance-based cost perhaps, for A&E and for the hospital. So that people have no fear about the cost of going to see their doctor, which is where they should be their first point of call, not A&E or the hospital.
Rika, you're a man with a young family. This must be a real issue for you.
Yeah, it is, but it comes back to Middle Jersey, isn't it? It always seems to be now Middle Jersey that's starting to feel the pinch. And in the long run, I wish like Middle Jersey would stop re-electing the people that are causing this. It's Middle Jersey that really comes out to vote, but they seem to be voting in the same people that's causing this and probably making us all ill. And it's like, it's every elections it's the same, and it is Middle Jersey now, whether for education, location and everything. It's Middle Jersey now that's feeling the pinch. I know, with my family, young family now, we're really feeling it, we earn quite, all right, but it's hard, whether it's your food, everything, and we are Middle Jersey, and it's like, and I know how I vote at election time, and it's, it's not for the ones that caused the mess over the last 10, 15 years, and I think the problem is when we go back to the real basics is at election time, I don't think people really look at who they're electing into the government, because it's the same people that have caused this mess, and this mess has been going on for about 20 years now. And it'll just carry on until we get some different thinkers elected in and people who can, hold their own. But if I should say now with collective responsibility, I think we're just heading towards the right mess. Personally, I really do.
Vicky, what about your take on this? Because there's obviously employment law issues for health, and there's people are long-term sick, etc.
In relation to,
in relation to people's general health.
Yes. So if someone's off sick, do you mean then in relation to their? I'm sorry, I'm not sure what.
Sorry, what I was trying to get at is that attached to all these health issues is how people are getting on. Does that can that cause problems in the workplace? Have you seen that cause problems in the workplace over here?
Yes, absolutely. And I think that there is a perpetual balance between the needs of the business to have people within the business who are getting paid to do the job actually being there, and the needs of individuals who may have illnesses or disabilities, and they've got to balance that with earning a living as well. So yes, I think there's a perpetual sort of dilemma pulling in opposite directions sometimes. And I think that one of the most important things is that whenever we're in a situation, whether it's the business thinking constantly about its bottom line, or the person thinking constantly about their problems, what they need to do is look across and say, okay, I'm suffering from this, how is the business feeling? The business needs to think my bottom line is suffering, but how can I help the individual get through it? So people need to be more, look at things more objectively as well.
Okay. Let's move that back across. Rod, you're all bound by collective responsibility. Are you allowed to talk about this?
Of course I am. And I agree with Len. I think we're in a situation it is being addressed. I don't particularly agree with Rico. I think we've got a situation where the primary care is being looked at. There is a whole new health system being considered at this point in time. The difficulty is with the doctors at the moment. They prescribe to a particular model and they don't want to change it. And we're actually suggesting the world has changed and they need to change with it. So one of the problems we're having to do is to have big discussions with doctors about how we do that. I think you're absolutely right. The middle earner does get pushed. And people are now not going to the doctor. I would like to see something that Clement, in a sense, was suggesting, is that pharmacists now take on a bigger role than they have before. So they have the ability, before you get into having to pay massive amounts to see a doctor for nothing more than a set of aspirin or a few antibiotics, to actually go to a pharmacist, describe your symptoms, and the pharmacist, who's highly qualified these days, could actually make a decision there will cost you considerably less. So we are looking at it as a government, and I think it's on the agenda.
Certainly.